All right. So most of you shouldn't have scored it yet. So what you'll do now is you'll score it. So you'll go from symptom number of 22, put the date and time of the assessment here. Symptom number 22, that'll be where you went to this area, which is a symptom evaluation. You'll just pull this number, whatever this number was, total number of symptoms, and then your symptom severity score, whatever that number is. That's going to come here. So your date time of assessment, let's just make it, yep, you did it yesterday. It would be yesterday, 10/23. Symptom number, symptom severity score, your orientation number, whatever your immediate memory number was, out of 15, you're going to put it there. Whatever your concentration number was, you're going to put it there. Was your neural exam normal or abnormal? You'll circle it. Balance errors out of 30. So you had 3 tests. You had single leg stance, double leg stance, tandem stance. So add those errors up, make it out of 30. Your delayed recall. Remember the neuro exam also has to do with the tandem gait. So that doesn't include the balance errors here out of 30, doesn't include tandem gait because the neuro exam includes that. So if tandem gait was abnormal, then the neuro exam would be abnormal. So if there's one neuro exam that's abnormal and the other 2 or 3, other 3 are normal, it would still be considered an abnormal test. So if I go back to, here's your neurological screen, passive full range of motion of the neck, cervical spine, eye movement, finger to nose, and tandem gait. If any one of these is circled no, N, the neurological exam would be abnormal. So all you need is one test for it to be abnormal. So that's a neuro exam. Delayed recall out of 5, put that number there. And then you'll come up here, date and time of injury, you're going to add that. Make it up if you didn't have a date or time that was already put up there. And then answer the question, is the athlete, truthfully, if the athlete is known to you prior to the injury, are they different from their usual self? Were they different in the test with the faking of the injuries? Concussion, did you diagnose? Let's just say you're a doctor, you can diagnose a concussion. Do you diagnose a concussion with this Scat 5? Yes or no? If retesting has the athlete improved, that's non-applicable. This is not a retest. This is just the first test you've done. And then I'm a physician or licensed healthcare professional. I have personally administered or supervised the administration of the Scat 5. Obviously, this is a scenario. You're not an actual doctor, but sign it. Sign it, put your name, put your title, Dr. Griffiths. Registration number is not going to be applicable. Put the date. Make sure these gray boxes are filled out, name, date of birth. You don't have to put address, you're the examiner, the date. And then here on clinical notes, this is where we would write clinical notes. So we're going to keep this, blank for now, but this is where you would write clinical notes. So if you wanted to write clinical notes, and you filled up, let's say you filled up all these lines. I'll give you an hour for filling up the lines. So it's probably going to take you about a half an hour to fill the lines up. Let's consider it like extra credit. I'll give you an hour for it. These clinical notes I'll give you another opportunity, can lend itself to where you can create a report. So if you wanted to use clinical notes, let's just say it was Josh banged his head, in a football game and you want to really kind of summarize what you found. You don't have to summarize all the tests or anything like that, but you would summarize anything that maybe you couldn't remark on the test itself because it's just testing. Maybe there's some other things that you know about the injury that you need to add to this. So that's where you would add it here. If you want to do clinical notes, you want to fill up the lines, I'll give you an hour. And then if you want to write a report, a medical report, this is where you would go. I'm not going to cover that with you. We're going to move into the next thing. This is where you would go online and maybe Google example medical reports, templates. And you want to create a medical report for this document. And it should usually be about a page or so. I'll give you however many hours it took you to create the report. So you just put on your hours, 2 hours, medical report. I'll give you the hours for that. Okay. If you're looking for some extra hours and you want to expand your, the process of this whole assignment. Okay. So what you'll do next, concussion injury advice, fake phone number, patient's name, date of injury, date of time, medical review, healthcare provider. You put your name on that. So complete that. And then just an example here on the back side of this Scat 5 is actually a lot of the instructions on how to perform the tests and how to score it. So if you ever had a question about how to score it or how to perform the test, you couldn't remember exactly how the test was, whether it was eyes open or eyes closed, this will give you that information on the back side of that. So just so you know, this really is a helpful summary of the tests and how they're run and how they're scored. This also gives you some concussion information, and it gives you a graduated return to school strategy, graduated return to play strategy also, but it's really a graduated return to school and graduated return to play. So here's your graduated return to play. You can review that. I won't review that too much here. Just know that there's a stepwise approach to graduating the athlete to go back to participation. We need to see, first of all, that they don't have any symptoms. If they still have symptoms, they do not start this graduated return to play. If they have, once they stop having symptoms the next day, they don't have any symptoms, we can begin to begin the process of returning them to play. If the symptoms return at all throughout that process, then it begins to go over, start over, and we go back to the previous step. So briefly, we light aerobic exercise, could be 10 to 15 minutes, see how they feel. Then they go into sport specific exercise, then non-contact training drills, and then full contact practice. Every step is a day. So usually we can get them back within 5 to 6 days after an injury. It says if any symptoms worsen while exercising, the athlete should go back to the previous step. Resistance training should be added only in the later stages. So it does give you, you can review this, read it on your own. It does give you some really good details and information on how to return an athlete back to sport after a concussion. And return to school after a concussion as well. There's something else I want to mention about this, and that is cognitive work or cognitive rest. So cognitive, we know the definition of cognitive rest. Let's say Josh suffers a concussion. It's pretty severe. Cognitive rest would be Josh. You have to go on complete cognitive rest, which means if you think about cognitive, the definition of cognitive is thinking, memory, anything that involves the brain and thought process we would end up having him rest completely. So that would mean anything, reading, listening to music, anything that causes him to think, he would be on complete cognitive rest. So which means he can't be on his phone, he can't do homework, he can't read, he can't listen to music, he can't watch TV, he can't do anything that it requires his brain to be active with cognitive ability. So it's rather boring, to be quite honest. Right? And so it's trying to determine, like, look, basically all you can do is either lay in bed with your eyes open or lay in bed with your eyes closed. And so we want you resting, we want you sleeping, we want you doing really basically nothing. And so that cognitive rest depends on the length of it. The length of it depends on the severity of the injury. It could be 1 day, it could be 2 days, it could be multiple days. So that's what cognitive rest is. So if you've ever had a concussion and you've been told you have to be on cognitive rest, you know what that feels like, you know what that looks like. You remember what that experience was like. And so we like to get you out of cognitive rest as fast as we can, but the more you do with regards to cognition, when you shouldn't be, it could be the longer the symptoms recur for. So just to give you an idea of what cognitive rest is when you hear that, or if you hear it.